All right, everyone, I think we are now live. So we're going to go ahead and get started with our session. Welcome everyone to the 2023 PI Conference. We will get started in just a moment. My name is Emma Mertens, and I will be your host for this afternoon's panel. Today, we will hear from several members of our Rare of the Rare PI community. Before we begin, please remember that everyone's treatment and condition are unique. The information presented during this session is not medical advice, nor is it intended to be a substitute for medical advice, diagnosis, or treatment. Our panelists are simply sharing their personal, unique experiences with navigating a rare diagnosis. Always seek the advice of your physician or other qualified health provider with questions concerning a medical condition. There will be time for questions after the presentation. Please submit any questions you have in the Q&A section of the platform. But without further ado, I'm excited to introduce our guests. Our first guest is Courtney Ampazan. Courtney Ampazan, MPH, was formerly diagnosed with WHIM syndrome in 2019. She was initially diagnosed with CVID at age 3, but after genetic testing, her diagnosis was corrected to WHIM syndrome. Courtney also carries the diagnosis of Evans syndrome, which further complicates her medical issues. In spite of her complex medical history, Courtney refuses to let her diagnosis dictate her life. She is currently pursuing her second master's degree in policy planning and management. In her free time, Courtney volunteers with various public health groups advocating for vaccines, patient and provider education, and systemic healthcare change. Our second guest is Renee Hilgren. Renee has been retired for 3 years, and she and her husband, John, have 2 adult children, Sean and Katie. Renee and her family enjoy camping, traveling, cycling, and NASCAR. Her son has APDS, and they have managed his PI since he was 3 years old with IVIG every 3 weeks. He had a stem cell transplant in 2021 when he developed plasmablastic lymphoma that didn't respond to chemo. It was at that time, at the age of 32, that Sean underwent genetic testing, which identified the PIK3CD variant, leading to a diagnosis of APDS. Our third guest is Cindy Kissick. At just 9 years old, Cindy Kissick was the second person in the world to undergo human gene therapy. Diagnosed at age 4 with adenosine deaminase severe combined immune deficiency, or ADA-SCID, Cindy spent most of her childhood and adolescence in and out of hospitals. Amidst her many trips back and forth to the National Institutes of Health in Bethesda, Cindy discovered she had a knack for helping others by simply sharing her story. This passion for supporting and making a difference in people's lives followed her into adulthood, where she made a career as an occupational therapy practitioner in the home health and pediatric fields, and as an outreach coordinator for a nonprofit mental health organization. Cindy currently resides in Louisville, Ohio, with Chris, her husband of 10 years, and with their 2 fur babies, a dog, Kevin, and a cat, Brian. When she is not weightlifting, practicing Tai Chi, or spending time with her awesome nephew, Cindy is very active with volunteering for different organizations, including the Immune Deficiency Foundation, the National Alliance on Mental Illness, and the ASPCA. Thank you all for joining us. All right, everyone, so we're going to go ahead and start our panel discussion. So our first question for our panel is, what strategies have you used to explain your PI or your child's PI with friends and family, etc., who are unfamiliar with your diagnosis? Who would like to get started? Anyone's game.
Okay, I'll start. This is Renee, and my son has APDS. And when he was first diagnosed with a primary immune deficiency, we explained that his immune system didn't communicate effectively, which made him susceptible to infections from others, and that he couldn't infect others with what he has. We made sure that we put the emphasis on that it wasn't contagious, that it was a genetic condition and not acquired, so that people wouldn't confuse it with AIDS, which was kind of in the news at that time. So we wanted to make everybody a little bit more comfortable with, what he had. And like I said, that they couldn't get his condition from him. We were more concerned about what he could get from others.
All right, how about
I
you,
think I'll go
Cindy? Would
next,
you
if
like to go
that's
next?
okay. Yeah.
Yeah.
Sorry about that. So back in the day when I would first explain it to people, it was that era where the boy in the plastic bubble, known as David, it was a big deal then, and it was very well known. Now that we've gotten kind of farther into more, treatment facilities and treatment options, and the kids are getting older, they don't know who that is. And so I'm keep trying to explain, like, oh, he's this amazing kid. You would have, this is what he's done. And this is like the pioneer that he was. So it's very hard now. I have to explain the same thing that Renee was saying, is that you almost have to remind people that it is something that they're born with. And it is something that was, obviously we were not chosen, but it's something that affects the immune system. And I always say it just doesn't work the way yours does. And that seems to work really well with everyone. Very simple, very to the point, because I think that's very important, just to be forthcoming.
And I think
Thanks, Cindy.
I think for me, what I always remember having to remind people is that they are more dangerous to me than I am to them. Like Renee was saying, to make sure that people understand that this is just my personal issue and I'm not going to be bringing these things or infecting anybody. And that, reminding people to be cautious around me without trying to make it, ostracizing me from the group, especially with other kids, to have to be like, you've got to wash your hands more around Courtney. You need to not be around Courtney when she's sick, and not to, it's a delicate balance between the caution and the inclusion, which I think is important for a lot of kids with immune deficiencies.
Certainly. Thank you, everyone. All right, our next question for the panel is, what advice do you have for someone who might be isolated by their rare diagnosis? So we know that PI as a whole is rare, not as rare maybe as many people think, but we know that this group, our rare of the rare group, has the rarest forms of PI. So how do you three, Renee as a caregiver, Cindy and Courtney as patients, what advice do you have to offer someone who might feel isolated, who might feel like, I'm the only person I know who has this, I'm the only person I know who has undergone these experiences? What advice do you have for those folks?
Well, I'll start, and I'll just say that, if a patient is feeling isolated, or even a family as a unit is feeling isolated, to have the discussion with your immunologist and ask for names of support groups, and perhaps other families that you could meet with that. I know personally that was something that we didn't really do, just because it wasn't that was several years ago, and we did feel like we were the only ones. But I think because we were such a tight family that it helped us get through it. So we kind of came together, but I could definitely see where support groups would help, so that you could, talk to other people that have, immune deficiencies, and, just ask how, they manage things. So that would be my advice.
Certainly. How about you, Cindy or Courtney?
So I want to piggyback off of that. I think the support groups are immensely important, and it is something that the Immune Deficiency Foundation itself offers a lot of opportunities for connecting with one another, which I think is amazing. Because the same with Renee, we had a really close-knit family, but we were very limited as to the amount of people that had what I had. So it was very difficult to kind of get to know other people at the time. And it was like the 80s and 90s. So the other thing that I can recommend, I want to piggyback off of that, is talking to your immunologist and your practitioners about seeking mental health help. And I think that mental health is so important, especially to families and those that have rare disorders or just any type of immune disorder in general, because it does affect, I mean, there are a lot of, mental health conditions that can arise or that we don't know about. The isolation can cause a lot of trauma, and all of that, I think, really needs to be addressed in a mental health way as well. And luckily, we have options now to where we can do telehealth and we can do, Zoom, and we can talk to people that are farther away from us. So there are a lot of opportunities now, but just connecting like through your immunologist and through the IDF, I think is great.
And I agree with both of them in finding support in the correct way. I always like to caution people about joining online forums that aren't moderated by someone who is a professional, because I'm in multiple groups for my various diagnoses. And I find that some groups are very helpful and supportive, and other groups can be very competitive almost, and say your experience isn't as valid because your numbers aren't as bad, or you haven't been in the hospital as much as I have. And it feels almost like a competition to be the sickest. And there's opportunities to go down some pretty scary rabbit holes. So I really caution people to join those groups. But there are some wonderful groups that are very supportive and very welcoming. And that's wonderful to, find. I think there are less than 100 of us in the world. To be able to reach out to other patients with WHIMS and ask them about their experiences has been extremely helpful and beneficial. But other groups, it has been really kind of sad and almost even more isolating, because I feel, that, confrontation. So it's a good thing, but to be careful with it for sure.
Certainly. Thank you, everyone. All right, our next question we're going to pose. How do you adapt to a world that is ready to return to normal post-pandemic and advocate for your own needs as an immunocompromised individual? How do we participate while also keeping ourselves safe?
I can start. For me, I have to be very honest with the people that I'm seeing. I have to be very selective as to where and when I'm going. And I think that advocating for myself and asking people who I'm around, if they're feeling sick, have they tested? And knowing that I feel safe around certain people. I think, I'm not back at work. I'm not back at school in person, but I am making those choices to meet people outside or meet people inside if I know that they're, as healthy as they can be. I mean, it's a personal journey for everybody, and everybody needs to make the decisions that are best for them. But I really do encourage people to kind of push themselves a little bit to find those connections, because it is so important to be with other people, even if it is in a new setting or a different way than we're used to.
I'll go ahead. So there were, at the beginning of the entire pandemic, I was very isolated. I stayed in the house and I made sure that I was just very careful. My husband was very careful, didn't come in the house with all of his clothes. He made sure that they were in the wash before he even came up the stairs. And, we kind of have adapted that. Obviously, I want to say, and this is not to be kind of joking, but in a way, when the pandemic came, I was thinking in my head, oh, this is game time. I have been training for this my entire life. I have been doing this my entire life. I am ready for this, because that's kind of how I've lived, being very safe, the whole hand washing thing, which sounds silly, but it's huge. Not being around people if they're sick. And if they are, then, happily, nicely, politely saying, I'm so sorry. but I'm going to have to go home. Or, even I kind of do this thing where I'm like, I'm really not comfortable here. So I think I'll just go home, but I'll catch up with you later. And that kind of works really well. Most of my friends and family members are very understanding, but when I'm meeting new people, or especially like through my employers, I have to be I still stand that 6 feet apart, and I still make sure that I'm very vocal about my concerns. And again, as long as I, preface it as soon as I speak to someone, everyone seems to be really understanding. So I think it's just a matter of of educating them before explaining what's going on.
Certainly. How about you, Renee?
Well, in our situation, right at the very beginning of the pandemic, is when our son developed his lymphoma, and then within like 3-4 months ended up with the stem cell transplant. We had to adapt to being isolated while being isolated, if that makes sense, because he had the stem cell transplant and then the pandemic was going on. And in a way, it wasn't like the best time to have it, but he needed it. And, in our case, it was kind of a blessing in disguise, if you can say it, that we had this pandemic, because as a stem cell transplant with a mask on and fully covered, he didn't stand out had there not been a pandemic. And so as things started loosening with the pandemic was about when his immune system, the new immune system, was starting to get back online, and he still had to, wear the mask while others were, learn slowly not wearing their masks. And he was just very careful. And we had very frank conversations during that period of time with, our family and holidays, that, people, were welcome in our home if they were vaccinated, COVID, flu, all of that. And if somebody had chosen not to be vaccinated, then we didn't have them around. And, that was a difficult conversation, but it was one that, would keep us safe as well. So.
Certainly. Thank you all. All right, so we do have some questions coming in with the Q&A, but I have one that I want to ask the group before we get into those Q&A questions. So my next question for you all is, what is a strength that you have gained from navigating your rare diagnosis, or your child's, in your case, Renee, that you otherwise feel you may not possess?
Well, I know I'd like to start on this one. A strength that we gained through this is to just be aggressive, and not be afraid of asking questions of doctors, and sometimes questioning doctors, as best as they are at what they do. When you're dealing with primary immune deficiency, and in our case cancer, and then stem cell transplant, everybody has to pull together as a team and just bounce ideas off each other. And in our case, because we didn't have medical backgrounds, didn't mean we weren't qualified to ask questions of the medical team. And sometimes they were just purely curiosity, but it kind of helped the team make the best plan of treatment for our son. So that's definitely a strength we got, was just the confidence in communicating with the medical team.
I think for me, along the same lines of asking the questions, is advocating for myself, and really being able to not back down when met with the, oh, well, you don't look sick, you don't, you're okay, and, having to be very firm and very loud when I know that something is wrong with me, because I've never presented classically with any time I've been sick. It's never been a textbook presentation. And, being told, that there's nothing wrong with me, and to go home, and then to end up back in the hospital the next day and then being asked if I have a living will because I'm so sick. And so experiences like that have really taught me to say no and really push for my health and what's going to work for me.
So I've learned quite a bit. There's not, I would say there's not just one thing that I've learned since having this diagnosis, but I can say that I have been able to better communicate, kind of the same thing along Courtney and Renee's lines, communicate for myself, but also communicate with physicians. I've learned to do my research. I've learned to, like we said, ask the questions and not be afraid to honestly be very upfront, like this is what I have to know for this reason. And the communication strategies that I've gained have allowed me to help others in situations like this, that's been amazing because I love helping others. But I've been able to say, okay, well, here's what I did. This is what you can do now. And that, I think that right there is so, I don't know, just amazing that I'm able to do that because I learned that, during my diagnosis.
Wonderful. Well, thank you all so much for sharing your unique perspectives. We now have some time available for Q&A, so we're going to go ahead to the attendee side and jump into some questions that have been asked. I do want to put a disclaimer. We have received some sort of medical focused questions, and that's not really what this session about. This session is really Renee and Cindy and Courtney sharing their personal experiences. We're not doling out medical advice. We're not giving diagnosis, information, or treatment. We're simply speaking on their unique experiences, navigating rare diagnoses as either a caregiver like Renee or patients like Cindy and Courtney. So I just want to emphasize that if you're wondering maybe why we haven't addressed particular questions, but we have gotten some good ones, and I'm going to sort of do a spin on them that I think we can make applicable to our panel here. All right, so we talked a little bit with our panel about, sort of quote unquote, getting back to normal and how do we protect ourselves as we get back into doing the things we love, whether that's NASCAR like Renee or Tai Chi or hiking, or even just going out and traveling and visiting friends like Courtney. What sort of protections can we put in place so that we're able to get back into the things that we love and then make us feel connected to others and make us feel fulfilled, but at the same time, keeping our medical needs at the forefront and keeping ourselves protected. So kind of keeping in that realm, we had one individual ask, I am going to travel by air for the first time since COVID. What steps in your personal experience might you take if you were going to do the same? And again, I want to emphasize, we are not giving this as medical advice. We are just asking our panel, if this was them in that situation, they're looking to travel, what sort of steps might they take to make themselves feel comfortable and protected?
Well, I'll start by answering because we did a similar thing when our son's immune system, the new immune system was starting to come back online, and it was probably 18 months after the transplant. We were taking a family vacation, and we did get on a plane. And one thing we did before this was from more of a transplant perspective, but it could just be from a mask perspective too, and COVID and all of that. But we kind of got the blessing from his doctors. We talked with them and, let them know what we were planning. And, early on, they said, well, you might want to wait a little bit. But then as we got a little bit further on and, the blood work was good and we knew where he was in that, then we started planning, and we all took precautions with that on the plane. We wore masks and made sure that we use hand sanitizer and kind of continued with the pandemic protocol, because it just lent itself really well to just keeping everything safe from an immune deficiency and infection standpoint. So.
For me, I've always been a little extra. And even before the pandemic, I've always flown with a mask, with hand sanitizer, and with Lysol wipes. And I wipe down every single surface that I could possibly touch. And I always sit on the window seat, and I sit with the air blowing down in front of me, away from me. And I minimize snacks, I minimize getting up, and I really just try to keep to myself. And that's something that I did before the pandemic, during the pandemic, and I'll continue to do so. Again, that's just my personal extraness, but it has helped keep me safe in traveling so far.
Yeah, so sorry about that. I kind of agree with both Renee and Courtney, but I always like to say, I like to plan ahead. I'm a big planner. So I make sure that I have like accommodations that I might need after the air travel, or like at the hotel or wherever I'll be staying, or even with the airline. I mean, you can always call the airline and ask them for, how are your COVID protocols? You can kind of get the information you need. But I always say, like, I make sure that I have my medication and anything that I might need on that in my carry-on on the bag. I mean, or in the bag. I know that sounds kind of silly, but that's like common sense. But I always make sure that I lay everything out the way I need to, so that I have it if I need it at any moment. So it's just being extra prepared, I think, is really important, especially with air travel, because it is, I've not yet gone on a plane either since COVID. So I'm kind of, I'm going to be in the same boat.
And another thing that I always do is I always get the travel insurance, and I get the insurance whenever it's offered for trips or hotels or concert tickets, because my health is so unpredictable, and that small investment has saved me quite a bit of money as I've had to interrupt several trips and cancel several events.
And I think the biggest takeaway from that, sort of from everyone's answers, just like everyone's unique condition, no one has the same exact complex medical situation. There's no one size fits all with, well, how do I keep myself safe when I travel? It's all about what's important to you as an individual, what makes you feel comfortable, and whether that's staying off planes because you're not there yet, or whether it's, putting extra precautions in place, being extra, like you said, Courtney, which it really isn't all that extra. It's all just about personal comfort. So a big takeaway I would say is everyone's different. Everyone's level of comfort is different. There's no sort of one size fits all for as we go back to normal, as they say. So thank you so much, everyone. All right, next question from the audience is, okay, so we know with complex PI diagnosis, and especially some of these more rare diagnoses, that there can be a lot of different symptoms. You're not just experiencing immunological symptoms. You might also have GI issues. You might also have dermatological issues, or, sinus issues. So this individual wants to know if you're experiencing a lot of different symptoms and you only have that, short 15, 20, maybe 30, if you're lucky, minutes with your doctor, how can you make the most of those short doctor's appointments and really get the main points across that you want to convey to your doctor?
I think I'd like to jump in really quickly on this one. This is, again, where the preparation comes into play. I am always, if I have like this little notebook that I write everything down in, and I know that a lot of the medication companies or the pharmaceutical companies, and I think even maybe the Immune Deficiency Foundation, have little things that you can ask your doctors. They have like little pamphlets or handouts. But I always write everything down prior to my even walking into that office. And then if it's something that affects, if it's something that's more maybe emotional or mental, then I talk to my husband and say, well, is there anything that, you're noticing that we need to put down, et cetera. So I feel very comfortable then walking in there and being prepared and ready to go, so that I don't fumble over what I'm going to ask, or leave thinking, oh, I forgot what I was going to say, or I forgot to tell them this. So that would be my recommendation.
For me, I find that it's very helpful now with the online patient portals. For a lot of my doctors, I like to email them ahead of time and give them a little preview as to what to expect from me. And I like that sometimes I can write them in the middle of the night if I'm up and say, here's what I'm experiencing. So they already know the background of why I'm coming in there. They've already had that first communication. And I agree with having everything written down. I also have a spreadsheet of all my medications, and I have a picture, an album on my cell phone of all my vaccine records, all my Metaport information, all the pertinent information that they might ask me about dates and times and things that would take time to look up or think about. I try to have all of that information with me. And I think now really leveraging technology is really the best thing that you can do in this situation, to have everything available at the touch of a button, or the preview email ahead of time. I think that that's always been helpful for me.
Yeah, and I'll piggyback on that as well. And what my son did, as he became an adult, is he did carry a thing in his wallet that kind of described his condition as best as they could at the time. And he was an over-the-road truck driver, and that came in really, really handy when he ended up in an emergency room situation right shortly before he was diagnosed with the lymphoma. And the doctor, he went to a hospital in a completely different state, and we just started the conversation with that doctor to say, before we start, here's what he has had his entire life, and then take it from there, because that puts that doctor then at he can look at that case as unique, because in our son's case, he had very aggressive lymphoma, but his blood work was completely normal. The doctor was just completely shocked that our son wasn't presenting as sick as he could have been with that. But, in the case of the immune deficiency, when especially with APDS, and it's, just so dysregulated, it caused the lymphoma, but then it didn't know enough to say, hey, there's something wrong going on here. So he was walking around like he still was okay, when in fact he was very, very, very sick. So having that information, just in his wallet, saying, here's what I've got, helped that doctor do what he needed to do in a very short period of time.
All right, thank you all. And sort of in that same vein, I want to ask this next question from our audience. So just as we're saying, you're not solely dealing with immunology issues, you might be dealing with other specialists in addition to your allergist and your immunologist. You might be dealing with a dermatologist, you might be going to a gastroenterologist. So keeping that in mind, how do you get your providers for your complex medical needs, your entire medical team, how do you get them to communicate across institutions? You might not all be going to one hospital to get all of your treatments. You might need to be flying to Hopkins. You might be going to Mass General. How do you get those clinicians who are part of your care team to communicate when they're not necessarily part of the same institution?
I think I'll take that one quickly. This happens a lot. This is where the advocating for yourself or for your loved one is extremely important. A lot of the patient portals, I would love to say that they intermingle, but they don't. And initially it was very difficult when I kind of transitioned into that adult care. from leaving my parents' insurance, going into my own insurance, because, mom and dad were always there to like help me out if I didn't know what to say or what to ask or what happened this last appointment. So when I became an adult and I started taking care of everything on my own, that's again, write everything down, but then also saying, okay, well, here's what I did this last week. I visited this doctor and this doctor said this. And I said, actually, here's all their emails. Here's their phone numbers. I'd like for all of you to kind of like get to know each other. And honestly, it was my immunologist that kind of reached out to everyone, all of my doctors, after I kind of asked him, can you help me out? And that was wonderful. And then I always just say, I will pull out the big guns and go to the NIH and say, hey, can you just take care of this for me? Because I think that you can just explain to everyone, but if I don't have that option, then it is me advocating for myself and making sure that everyone's on the same page.
Yeah. And I'll add to that as well. I know with our son, he was, and he still is in the care of the Mayo system here in Minnesota, as well as NIH in Bethesda. And, the two of them do really communicate, because like with our Minnesota team, it's not just one department either. It's like a trifecta, which then is communicating with NIH and back and forth again. So it's just, keeping everybody kind of in the loop and on the same page with the current information as best we can. So.
Yeah, in my situation, I'm extremely lucky, and I know because I've gone through a plethora of primary care physicians, but I found a relationship with my current primary care physician in that I do use the patient portal and I say, here are all the appointments that I'm going to this month. And then their office goes and contacts all of them to get the notes and make sure that they're included on that. So I'm very fortunate that my primary care doctor's office does all the legwork for me, as long as I just tell them, here's who I'm seeing this month, and then they will follow up and find the information. So having that conversation with your primary care or, an office that you think might be able to handle it, because a lot of doctors might not be able to do that, but finding that support and care of somebody else being able to be the quarterback so that you don't have to do everything yourself is really helpful.
Certainly. All right. And then our last question from our audience, and I think, Cindy, you sort of touched on this piece in your response to the last question. This individual wants to know, can anyone else on the panel elaborate on their transition from pediatric to adult care for parents that may be dealing with that new stress?
Yeah, so it's only fitting if I talk about it. So yes, that was it was difficult at first, but I had a lot of help because my parents were very, very supportive. So I was very fortunate on that. And to kind of guide me. And if I had any questions, I was like, okay, so, hey, how do I do this, Mom? And she was pretty helpful. But what I learned is that most people, this is anywhere, in any facility, in any organization, in any hospital, if you just ask the questions, like, listen, I'm doing this on my own. I don't know what I'm doing. Can you help me out? They're going to help you out. It's just that simple. And it sounds kind of silly to say it very simply, but it is just a matter of that communication and saying, like, if you don't know something, always ask the questions. And first and foremost, I would definitely look at your insurance, of course, and what insurance you're going to be going into, and making sure that all of your physicians are covered under that insurance. And if not, then now what do I have to do in order to make sure that I can pay for these visits that may not be in network? Or speak to the immunologist and say, hey, this is where I'm coming from. Can you help me explain this to my other physicians? So a lot of it is just a matter of communication and being able to advocate for yourself, but it's just honestly asking questions of people, because everyone is willing to help if you need it.
Yeah, and from in our case, with us as the caregivers and our son as the patient, when, he became 18 and was, kind of on his own, but yet he was with our insurance. I mean, we had been, so used to going to every appointment with him and actually going into the room with him. And when, we were, really couldn't do that anymore, it felt kind of strange from a parent's perspective, because we thought, oh my gosh, now it's like he's having to digest all of that information. But we were fortunate to have his immunologist was basically his primary caregiver, and he was the one who diagnosed him and was with him until he retired. So our son, even when he was in college and then on the road, with his work, would come home every 3-6 months and visit his immunologist and really get that, because he was actually doing, he had a few years where he was actually doing okay immunologically until the lymphoma happened. But just having one point of contact with the immunologist was our our experience. And our son, as far as insurance goes, actually was able to maintain that coverage with the immunologist. But from a parental standpoint, it was kind of hard for us to let go, because we always like to ask lots of questions and be there with them. So
I think what was helpful for me was, as I was growing older, my mother, who was my primary caregiver, would have me start doing things for myself with her being there. Start with small things that are not as consequential, like, have your child go up to the desk and present and say, my name is Courtney and I'm here for my appointment. And really just even those small things, starting as soon as you think that your child is able to handle those, to give them the small wins, to have that, to help build that confidence in your child, and to help you realize it's okay to step back a little bit and watch them. Because parents of children with primary immune deficiencies, at least in my case, they're very protective and want to do everything and want to care and are very nervous and anxious. And so starting very young, having your child do increasingly more things for themselves was really helpful, so that when, I turned 20, it wasn't, okay, good luck, you're on your own, have fun navigating the system, is a tire fire, go for it. It was, oh, I know how to make my appointment. I know how to call my doctor's office. I know how to ask the questions and talk directly to my doctor. It's not easy for anybody, because I didn't want to do it, and my mom just wanted to do everything for me as a way of helping and caring for me. But it's really the most beneficial thing that you can do, to start early with small incremental steps to kind of give that independence.
yeah. And if I could add on to that as well, when our son was really young, we would administer his IVIG, in the privacy of our own home. And as he got older, he did transition in his, I would say, mid-teens from IVIG to sub-Q IG. And it was at that transition that he then took over the role of administering his medicine sub-Q, rather than us accessing a port with the IVIG. So that was a step that when he was ready for it, he took that on, and he wanted to learn it, and he wanted to have control over his own health. So.
All right, well, thank you so much. That is going to close out our Q&A for today's panel. I just want to thank you so very much, Courtney, Renee, and Cindy, for taking the time to share your unique experiences and your insight. I know you guys can't see the chat on the attendee side, but I just want you to know folks are chatting in saying how impactful this was and how much they appreciate you sharing your experiences and your insight. And I think this is so important for other folks with rare diagnoses to hear, we all have different conditions, but there are some shared experiences amongst us. And we definitely have a lot to share as far as information and just support for one another. And we so appreciate your time this evening. And I also want to thank our audience so much for your questions and your engagement. And before we close out, I just want to briefly touch on a few IDF resources that we have. We have so many opportunities at the Immune Deficiency Foundation to connect and collaborate with others in the PI community. For those who are in the chat, some of the folks from our team were sharing some resources relevant to some of the topics we spoke about on the panel this evening, as far as travel, as far as our immunocompromised card resource for folks. And we really hope that you'll remember to check out these resources and really to make the most of all of the different opportunities we have to connect and collaborate, whether that's joining Lunch and Learns or webinars or getting involved with the Get Connected group, or joining us for a conference like the one that we're at today. So thank you so much. And I also just want to remind our audience that all IDF education programs, including all 39 of the conference sessions from our 2023 conference, are being recorded, and they will be uploaded to primaryimmune.org, as well as the IDF YouTube channel. So if there are any sessions that you didn't have a chance to tune into, or if there were two going on at the same time that you didn't want to miss, those will all be available to you for free on the IDF YouTube channel and www.primaryimmune.org. So thank you so much again to our panel and for joining us, for taking the time to share your experiences this evening. We so appreciate it. And to our audience, we hope you'll continue tuning in today as we explore other critical topics for the PI community. Thank you so much and have a great rest of your evening.